So I'm going to be presenting on early sexual experiences and substance use among African American behaviorally bisexual men. The data that I'm going to be presenting is descriptive data from an intervention that is just coming to completion. So some background information. So we know that HIV prevalence among Black MSM is very high, more than twice that of white and Latino MSM. We know that infection directly or indirectly related to men having sex with men is the single largest contributor to HIV among Blacks. We know that sex with men account for nearly half of all cases among Black men and a substantial but unknown number of cases among Black women. So Black MSMW, Black men who are bisexual, have been particularly underserved and underrepresented in HIV interventions. In addition to that, so has the issue of childhood sexual abuse. Now, one of the things you're going to hear me talk about in the intervention is early childhood sexual experiences, early sexual experiences. And I go between early sexual experiences and using the term childhood sexual abuse. I'm really talking about childhood sexual abuse. But when I did this study and with the men, one of the things that you've heard here is the issue of language today. We have to be very careful about the language that we choose because the way in which you ask a question will give you a different response. If you ask these men, have they been abused, they're going to respond one way. If you ask them about their behavior and you describe certain things and ask them if this happened to them, they will answer a different way. So what I'm really talking about is childhood sexual abuse. CSA may influence current sexual decision-making and contribute to tendencies of males to victimize external control over sexual behaviors to partners. This may come out as adult re-victimization or relationships where there is intimate partner violence. We have to remember, our past influences who we are today. And so we have to understand what these early sexual experiences have done to influence our current sexual decision-making. The working definition that I use for CSA is experiences before the age of 18 where the person experiences any unwanted or forced sexual contact ranging from touching or fondling to intercourse, or having sexual experiences with someone at least 5 years older. That 5 years age difference, one of the things that I emphasize here is that there are power differentials. So as I go through the data, I'm going to be talking about teens and adolescents, and people may say, well, how can that teenager who have that experience, is that really sexual abuse? When you start talking about power inequities, we are going to get back to child abuse. CSA prevalence rates range between 4% to 76%. That's a huge rate. What does that mean? Well, the problem is that those rates have come from studies that vary in definitions. Definitions of child sexual abuse is huge. So for example, some investigators may say, well, it's not sexual abuse unless the age differential is 10 years. Well, 10 years is huge. That's one issue. The other is also reporting. Many times we have situations where men and boys may not report it as sexual abuse. They may not appraise it as sexual abuse. And I'll talk about that, the issue of appraisal or how a person interprets or defines a certain behavior. So getting accurate statistics on CSA is a very complicated issue. We've seen it in the female literature, and we're seeing it now in the male literature. The male literature has lagged behind the attention that has been given to women. CSA is not typically addressed in current HIV interventions for men in general, for gay or bisexual men. So it's something that has clearly lacked attention. We know that men with histories of CSA are more likely to develop psychologic distress, comorbid depression, PTSD, post-traumatic stress disorders, and engage in what has been called serial sexual encounters. And this is interesting. So when we talk about serial sexual encounters, we're talking about generally what we would consider the casual one-night stands. There's not emotional intimacy involved in those relationships. So that's one example of where men with histories of CSA are seen. as far as their sexual relationships. Another type is rapid cycling of intimate partnerships. Now this is interesting. What we see here are men who get involved in relationships and they truly believe that this is an intimate relationship. They are in love. So what happens when you're in love? You're less likely to use a condom. You love this person, you have this intimate relationship, so you're at greater risk of not using a condom and protecting yourself because it's a relationship. It's not a one-night stand. And then, of course, we have the combination of the two. So men with histories of CSA are at risk for HIV. We're starting to see more and more studies that support this suggestion. Many men abused as children experience persistent problems revolving around sexuality and sexual activity through adulthood. Now the problem with this is, for many of these men, they don't present to mental health providers. Instead, they may go to their general practitioner or their urologist, and they may be complaining about physical symptoms. And so in that situation, again, when we start talking about history taking, nobody is asking the question, well, did X, Y, and Z happen to you? And getting to the physical symptoms. Victims of CSA are more likely to be sexually re-victimized and less able to negotiate sexual activity as adults. Dr. Wyatt, this was one of her early studies. When you think about development and you think about children in their adolescence exploring their identity, exploring their sexuality, in a healthy environment, it's a healthy exploration. They discover what they like, what they dislike. They're able to set boundaries. You know, I'll do this, I won't do that. But when children are abused, when something is forced upon that child, it impacts their normal developmental process. So what does that mean for them? Are they able to experience this where power is taken away from them and still be assertive? You know, what we're finding is that these experiences of abuse traumatizes them, interrupts their normal development so that they're not able to set safe and healthy boundaries for themselves, and they're more likely to be re-victimized again in childhood and more likely in adulthood. We're starting to see this pattern come out in the literature, re-victimization in adulthood. We know that associations between CSA and unprotected anal sex among MSM exist. So we're seeing clear links between CSA with psychological distress and CSA with high-risk behaviors. And now we're also seeing associations between CSA and substance abuse. So substance abuse. Injection drug use is the third leading cause of HIV following male-to-male sexual contact and heterosexual contact. Injection drug use may add to high rates of infection, being at risk from not only sharing unclean needles, but also from engaging in unprotected sex while under the influence. One of the things that we have to remember is that injection drug use varies from region to region in the United States. Here in Los Angeles, we don't have a large injection drug using population. However, part of the risk is also being under the influence. So regardless of whether it's IDU use, injection drug use, or other drug use, it's the impairment, the inability to make cognitive, healthy choices. And then, of course, we know that drug use can affect treatment success. HIV interventions for Black MSM and MSMW who are HIV positive and who have a history of CSA are needed. For a while, there was a heavy emphasis on prevention. But you know what? We have to remember that there's a population, there's a huge number of people who are already infected, and they must get the attention, they must get the education to prevent themselves from getting HIV reinfected, as well as from transmitting the virus to their partner. So we need harm reduction interventions focusing on those who are already positive. We talked a little bit about the issue of labels, gay versus non-gay, same gender loving. And here we go back to the issue of language. For non-gay identifying African American bisexual men, we have to look at if they're even getting the prevention messages. if for these bisexual men who don't identify as gay or don't feel comfortable with bisexual labels, if they hear these prevention messages, but because they don't identify with those labels, they miss the prevention messages, then they are at great risk. So we need to, again, revisit this issue of language.